Hello everyone, I am Dr. Yousufuddin Ali Khan, third-year resident in Pathology in Detroit Medical Center, and we worked on the efficacy of subtractive coordinate immunoreactivity pattern, which is abbreviated as SCIP approach for immunohistochemical evaluation of serous effusion with scant cellularity. So a diagnosis of metastatic carcinoma in serous effusion fluid is essential in establishing the cancer stage. Many carcinomas, including those from the lung, breast, genitourinary and gynecological tract with metastasis to serous cavity, are considered as a late stage of the tumor. The cytopathological evaluation results of these serous effusion help the physician in establishing prognosis and management of the patient. One of the major challenges faced in evaluating serous effusion in identifying the malignant cells in a scant cellular specimen. Furthermore, deep resectioning of the paraffin embedded cell blocks of these scantly cellular specimens for immunohistochemical stains make it more challenging and time-consuming to correlate them with the H&E stains, which is the hematoxylin and eosin stain. We used the SCIP, which is a subtractive coordinated immunoreactivity pattern approach that was described in detail by Dr. Shidham and Dr. Atkinson for identifying and localizing the metastatic cells. So SCIP approach allows construction of a topographic map clock to clock position of various components in the specimen. In simpler words, when two or more slides are made that includes hematoxylin and eosin stains, and the following slides will have the cells at the same location of the slides when we put it under the microscope. For example, in this picture of H&E stain, we can see this round ball of metastatic cells that can be followed on the subsequent immunohistochemical stains, but like in this one, BRAP4 and Vimentin, and following it up with a GATA3 IHC stain, following it up with the estrogen receptor stain, and following it up with the cytokeratin stains, cytokeratin 7 and cytokeratin 20 in this case. In this case, we can see here, this is the evaluation of malignant pleural effusion by SCIP approach that shows the H&E section of the cell block and the subsequent following it up with immunohistochemical stains. We can see that the same ball of cells are present in the subsequent immunohistochemical stains, and here we can see that the tumor cells, the ball of cells, are staining for BRAP4, which is an epithelial marker, and it is not staining for Vimentin, whereas the cells adjacent to this ball of cells are staining for Vimentin as red, and these cells are the reactive mesothelial cells and inflammatory cells. On subsequent slide with the immunohistochemical stain with GATA3, we see that these ball of cells are staining positive for GATA3, and on follow-up on the next slide, we can see that these tumor cells are not staining for estrogen receptors, and they are staining for cytokeratin 7 and they are not staining for cytokeratin 20. This is a common immunohistoprofile of a breast carcinoma. However, estrogen receptors can also be positive in breast carcinoma. So in our study, we are evaluating the amount of time spent, the ease of interpretation, and the diagnosis using the SCIP protocol in comparison with the random method. The purpose of this study is evaluation of the SCIP approach for its efficacy and sensitivity in picking up positive malignant cells in effusion specimens with scant cellularity that are difficult to categorize as positive or negative in comparison to the random immunostaining method. So we retrospectively searched our database from January 2014 to September 2019 and selected 40 cases of serous effusions that included pleural, peritoneal and pericardial effusion fluids with scant cellularity that already had immunohistochemical stains. The cases with obvious detectable and interpretable tumor cells were excluded from the study. Of the 40 cases, 20 cases had immunohistochemical staining by SCIP protocol and 20 cases had immunohistochemical staining by random methods. These cases were divided into two groups randomly. The identifier were hidden except for the type of immunohistochemical stain. The slides were reviewed by 3 pathology residents, 1 cytopathology fellow and 1 cytopathology attending. A brief history and a questionnaire were given to the reviewers along with the slides. The questionnaire covered the diagnosis of the case, time spent on each case, and the ease of interpretation that was graded from 1.0 to 5.0. The ease of interpretation was graded based on the quality of the slide and the ease of finding the cancer cells that are seen on H&E slides to see on the immunohistochemical slides. We found out that the average ease of interpretation using SCIP protocol is 4.25, ranging from 3 to 5 out of 5 compared to 3.7, ranging from 1 to 4.5 out of 5 by random methods for cases that are positive for metastatic serous effusions. The mean time spent on each case using SCIP approach was 9.1 minutes, ranging from 6.0 to 11.3 minutes compared to 10.5 minutes, ranging from 8.0 to 15.6 minutes using the random method. No significant difference in time was noted comparing the SCIP approach to the random methods in the non-metastatic effusion samples. There was no discordance in the diagnosis of reviewers between the cases by SCIP as well as the random methods. So our study indicated that the SCIP approach is efficient in time in diagnosing malignant serous effusion with scant cellularity. SCIP approach for making immunohistochemical slides has an improved quality shown by the ease of interpretation as compared to the random methods in the analysis of serous effusion with scant cellularity, as the results show that the ease of interpretation by SCIP protocol is 4.25 compared to 3.7 by random methods. Thank you.